Hello student, I am Dr. Rajesh De, SR in the Department of Community Medicine. Today I am going to take a class on family knowledge and practice on common health problems and healthcare seeking behavior. This class is a part of your family practical guide. Now, introduction. All the people, whether rural or urban, have their own beliefs and practices concerning health and diseases. Not all the ideas and beliefs are bad. Some are based on centuries of trial and error and have positive roles, while others may be useless or even harmful. Some have stood in the way of acceptance or utilization of health services. It is therefore essential to know people's knowledge regarding disease causation and health promotion, and this is to understand the factors that influence people's decision and adopting a healthful behavior and proper utilization of health services. This will help to identify the areas where communication is needed. If people know that what are the services available to them and how these will help them to get rid of disease and maintain health, they will be motivated to utilize the services surely, and in the long run will provide their support to improve and maintain them. So, what are the learning objectives of today's class? It is to understand what are the preventive and promotion services available to the people for common communicable and non-communicable diseases. To collect information on knowledge, beliefs, attitudes and practices of the family towards health and disease conditions. To collect information on extent of utilization of existing health services by the family, and lastly to identify the factors which influence their utilization behavior and recommend necessary actions. Now, directly coming to the knowledge regarding causation, modes of transmission, prevention and care seeking behavior with respect to the following communicable diseases. You have already know about the communicable diseases, and there are lots of communicable diseases mentioned in your textbook or you have learnt already, but in case of practical part during your family visit, you will not be able to collect the knowledge of the respondent of the family or the whole family regarding all the communicable diseases. So we have selected some important communicable diseases that are most common in Indian context or in our Bagbazar slum area, that is the field area of our department where we usually visit for the family practical part, and those most common communicable diseases are diarrhea, pneumonia or cough and cold, malaria, dengue, tuberculosis, HIV/AIDS or any sexually transmitted disease, and others. If a specific disease exists in the family, then you have to mention in it. Initially, you have to ask the respondent of the family that whether he or she has ever heard about the disease or the name of the disease, like diarrhea, and you put yes or no. That has been mentioned in your family book, that is also your data collection sheet. So you initially write just below the specific name of the specific disease, yes or no or y/n. Like an example, in a family allotted to your batch, you have asked the respondent of the family that whether he or she has heard about diarrhea. If he said yes, then you please put Y just below the diarrhea, or if he or she has said that she had never heard about the word diarrhea, then put N and follow this follow this sequence or this style for all the mentioned communicable diseases like pneumonia, cough and cold, malaria, dengue, tuberculosis, AIDS, STD, etc. Next, you have to ask the respondent that what are the cause of that particular disease, like what are the causes of diarrhea, what are the causes of pneumonia, what are the causes of malaria, and you should write in your data collection sheet as per the language and as mentioned by the respondent. It should not be translated or it should not be modified according to your own language or in medical term. It should be written in the exact term or exact form which have been mentioned by the respondent of the family. And after causation, you should write the mode of transmission as mentioned by the respondent of the family member. That is, you have to ask again the respondent about the transmission of the disease, and whatever he or she will answer you, you have to mention in the respective space of your data collection sheet. And lastly, you have to ask about the mode of prevention, that is how it can be prevented. For like diarrhea, how diarrhea can be prevented, or how pneumonia can be prevented, how malaria can be prevented, like that. And the whatever respondent will give answer to you, you have to write all the things in your data collection sheet in the exact form of the respondent answer, not modified by yourselves. And like that, you fill up for all the disease mentioned here: diarrhea, pneumonia, malaria, dengue, tuberculosis, AIDS, STD, and any other specific, and you will able to complete this part of your data collection sheet. And at the end of this communicable part, you have to ask about the care seeking behavior. That is, if the family, any member of the family has been suffering from diarrhea, or he or she had suffered from diarrhea in the past time, then the family then where the family visit for treatment or for healthcare purpose. And you also ask this to the respondent of the family member, and you will have to write this in the lower portion of this your data collection sheet, just below the table. Next, coming to the non-communicable disease, it is also the same thing: the causation, risk factors, prevention, and the care seeking behavior with respect to the non-communicable diseases. And you also know that there are so many non-communicable diseases and prevalent in India nowadays, but most prevalent one has been mentioned in your data collection sheet, because all cannot be possible to mention in your one data collection sheet, and it is not feasible practically for you to collect information about all the non-communicable diseases. So the most important one have been mentioned in your data collection sheet, and you have to collect the data regarding these mentioned communicable diseases. And as like communicable disease, here also you have to initially ask the respondent of the family member that whether he or she has heard about the disease like hypertension, diabetes, cancer, heart disease and stroke, and then you have to ask about the risk factors. In case of communicable disease, you know that there is multiple risk factor for different type of non-communicable diseases, and you have to identify this risk factor by asking questions to the respondent of the family of the allotted family, and you write the risk factors they know in the risk factors column, and you ask the family member about the mode of prevention, that how the disease occurrence can be prevented, and you write in the mode of the prevention column. Just for an example, for hypertension, you have to ask the respondent of the family member that whether he or she had heard about the hypertension. If he or she heard, then how it occurs, and in response, if the respondent mentioned that the hypertension occurs due to the excess consumption of salt, then you should write in the risk factor column that excess consumption of the salt, like that. And it should not be, again I am giving emphasis on the point that you should not write the risk factors as per your modification. It should be written in the form mentioned by the respondent. Here, like the respondent mentions that excess consumption of salt leads to hypertension, then you should write the excess consumption of salt as risk factor. And same like in case of mode of prevention, here also whatever respondent will say, you have to write in modes of prevention, like he or she may tell that less consumption of salt may be the mode of prevention of hypertension. Then you have to write that less consumption of salt is the mode of prevention of hypertension. It cannot be modified as your own perception, because at the last of our total family practical part or family visit, we have to give recommendation to the family, and to provide recommendation we have to generate some recommended points, that is we have to generate some gap in the knowledge and the knowledge part of the family, and we have to fill up this lacunae of the knowledge from our part. So if you modified here according to your own perception, then it should not reflect the actual knowledge of the respondent of the family, and you will not be able to find out the gap. So for that reason, I am giving emphasis that it should be taken as the respondent says, and lastly you have to generate or you have to find out the lacuna of their knowledge, and you have to give recommendation according to that. So as I given the example of hypertension, you have to also ask the respondent of the family member regarding diabetes also, regarding cancer also, regarding heart disease and stroke also. And what question will you ask? I think you have already read in your textbook in details regarding hypertension, diabetes, cancer, heart disease and strokes, and you also know about the what may be the risk factors of those particular non-communicable diseases, and according to that you have to ask questions of the respondent of the family member. Or if but you should not give the direct hints to the respondent that he or she just reflect your hints as his or her answer. So you just ask him or her about the risk factor, that is he or she whether he or she knows that the how the diseases have been occurred or not, and you have to write in the respective column. And lastly, again, like communicable disease, here also you have to ask about the care seeking behavior, that is if the family, if any member of the family is suffering from any of these non-communicable diseases, or the or in the family there is any of the non-communicable diseases, then and where they will seek for the treatment or for the health care at present and also in the past, where they have sought for healthcare facilities. Now, next, coming to the visit to the health facilities, it is not directly to the knowledge of the communicable and the non-communicable diseases, but in your family practical guidebook, it has been collected as an added data to assess the knowledge of the respondent of the family or the family for regarding their regarding the visits to the health facilities for a particular health issues, and it should be identified during your family visit, because it gives also some insight to you, that which may lead to you in the later part to give a recommendation to the family, the actual things, that is the actual health facilities where he or she has to visit for this specific problem. So for that reason, you should ask the respondent of the family that where he or she or where the family visits to visits for minor ailments, that is they visits to private, government or others. Others means medicine shop or any NGO run clinic, etc. For major ailments, same like that above. For antenatal, natal and postnatal care, same like above. And for preventive services like immunization, family planning also. And if health facility is not visited regularly or not at all by the family, then you should identify the reason why they are not visiting to any health facilities or not visiting to any health facilities regularly. All this information will provide you to identify the healthcare utilization pattern of the family also, that is they are utilizing private facilities more or government facilities more or any other government sponsored or any NGO type facilities is more, or if they are not availing any type of health facilities, then why they are not availing. And lastly, according to that, you have to educate the family, you have to provide adequate information to the family regarding the health facilities, and you have to recommend them accordingly. Now, the knowledge and the practice about personal hygiene. It should be also added data which can be indirectly related to the causation of these communicable diseases, and to identify their knowledge and regarding the communicable disease which I have mentioned earlier, and the causation of the diseases, their personal hygiene measures how their personal hygiene measures are has to be identified by you. So, and it is indirectly related to the causation of the disease. For that purpose, you have to ask about their personal hygiene measures like hand washing technique, when, with what. You all know that hand washing technique, and you just ask about the respondent of the family that how to wash your hand, and you have to ask them to demonstrate demonstrate to you, and you have to ask their knowledge regarding the hand washing, and you have to write in the particular column, and you have to ask them demonstrate regarding the hand washing, and you have, if you found the knowledge is that if you find the practice and the knowledge is same, then in the practice column you may write the same as knowledge. Or if you find the practice is good but knowledge is inadequate, then you may write that practice is good but knowledge is inadequate. And all these things here actually you have to ask about technique, when to hand wash, with what hand wash. They will, whatever they will say, you have to write in knowledge part. And in practice, in some case you will find that they have some knowledge regarding these particular issues but they will not practice, and there is also the knowledge and practice gap. And you should identify this knowledge and practice gap, and you have to identify identify this gap, and you have to recommend the family according to this gap. So this is also an important part of your data part of your data collection sheet, and you have to collect it meticulously. So after hand washing, you have to ask regarding brushing teeth, that is frequency and with what they are brushing their teeth, their regarding their bathing, the nail care, their hair care, etc. Then you have to ask about their menstrual hygiene and what they are using their for the during this menstrual period, etc., etc. And but for menstrual hygiene, usually the girl student ask the female respondent of the family, otherwise it will create a mess. So be careful about that. And lastly, you have to identify the problems of that family regarding that, and you have to write in bullet point in the just below this box. And so this part is for today, and the other part regarding the knowledge and the practice of the family regarding the antenatal care, postnatal care, and the any preventive services will be taught by other teachers. And thank you students, have a good day.